Welcome to the Marvelous Middle Age Podcast, where we are building a community of people who are in the midst of midlife, sharing our stories and learning from each other along the way. Each week, I'll have a guest join me to discuss a topic that impacts our lives and touches on some aspect of midlife. We'll discuss relationships, transitions, health and well-being, parenting, careers, and more. My goal is to encourage and support you and help you thrive as you navigate this adventure of midlife. Join me here each week for the Marvelous Middle Age Podcast. In this episode of the Let's Talk Menopause series, we talk about the next steps you can take if you are interested in learning more about hormone replacement therapy, what questions to ask your healthcare provider, and so much more. I share briefly about my experience being a patient of Dr. Teggatz as I prepare to start hormone replacement therapy soon. If you haven't already listened, be sure to check out the first 3 episodes of this series. Dr. Teggatz and I provide an overview of perimenopause and menopause, including symptoms, how to best take care of yourself during this time, and a deep dive into hormone replacement therapy.
Mine is not the only one, but
Yep.
my opinion is that hormones are safe and have these benefits
Great efficacy
and can be given indefinitely.
Well, and that kind of leads me into, my next question is that, we've talked about perimenopause and menopause and the symptoms and the impacts on our health and what we can do. We talked about lifestyle change in an earlier episode. We've talked about hormones and hormone replacement therapy and a lot more. So, for the listeners that are hearing all of this information and they're like, okay, I want to do something. What do I do next? What would be your recommendation if someone is interested in learning more about this, about whether it's hormone replacement therapy or just more about perimenopause and menopause? What would you recommend that they do next?
Well, I would recommend you talk to your doctor. So whoever, either your primary care or gynecologist, if you're having symptoms, tell them what your symptoms are and ask them how they feel about hormone replacement therapy. That would be the first place to start. Maybe ask, how often they prescribe it. Do they prescribe bioidentical? Do they do topical? I mean, the patch is still an option. I do oils, but the patch is an option. Do they stop after 10 years? So I would start there. There are some good books I would recommend and a couple of websites and podcasts. So menopausemethod.com is a website that basically across the country, they do have physicians who are trained in the way I prescribe them. So that is what, and there's also information on there. And Dr. David Rosensweet, who developed the menopause method, he wrote a book. Great. Oh gosh.
I'll get the link in the show notes. You don't have to think of it.
Thank you. He wrote a book that you can actually get a free digital download of the book.
Oh, cool. I'll put the link
read
in there.
About it.
Excellent.
The whole breast cancer issue, Dr. Jen Simmons has a podcast and has written a couple of books.
Great.
She's another resource.
Wonderful.
Those are some resources you can learn more.
Right. I've talked to a lot of people and I have said before, if you're interested in learning more, pursuing more, educate yourself.
Right.
Because I think to your point, there are some, and I'm not saying this is true of all providers, but they don't really know as much as maybe they should about, especially if they're not, a specialist. If you're just going to your general, healthcare GP or general provider.
Unfortunately, not a lot of attention or training, frankly, is given in medical school and residencies. I mean, OB-GYN residencies, family practice residency, which I did very little attention was given to this. I had to, go get outside training to know how to do this right. Hormones are complicated.
Yeah.
So for the, average practitioner who takes care of lots and lots of different conditions, I mean, it takes some time and you need to spend some time learning this. And, just not everybody does.
Right.
And I think also just the benefits that I went over,
Mm-hmm.
those benefits are not communicated well
Mm-mm.
to physicians. Those benefits are real.
Right.
And I think a lot of attention is given to breast cancer, and a lot of
Yeah.
women are,
Yeah.
somewhat fearful of breast cancer.
Yeah.
But actually, cardiovascular disease is the leading killer. More women die of hip fractures than breast cancer.
Mm-hmm.
I did not know that.
Yeah.
We don't really talk about osteoporosis that much. So
No.
that is an element. Just women are afraid of breast cancer. Doctors are afraid of breast cancer. We stay away from breast cancer. But you even if there were an increased risk, you do need to weigh that against the 30 to 40% decreased risk of all these other things and living longer.
Right.
So,
well, and we're going to spend a third of our lives in this stage of life, right? And so to think about a third of your life with all, I mean, and again, everyone experiences the symptoms to different degrees and in, intensities and things like that. But even if you have a few that are kind of debilitating to you,
not sleeping,
not
that's
sleeping
huge.
alone.
If you and getting good quality sleep actually improves your health.
Right.
Anxiety. I have a couple of patients, severe hot flashes, debilitating, had to change jobs because it was so severe, and her physician wouldn't prescribe hormones. And
that's life changing right there.
Yeah.
I mean,
So
that's changing your employment.
Right.
I mean, and I've heard stories of that as well. And the impact that it has on the economy, that menopause has on the economy in workplaces is insane. I know there's some states right now that have laws kind of going through their legislatures on changes to workplace accommodations for menopause, which is just awesome.
Yes.
It's like, yes, go.
Yeah. So the increased attention to this, very normal transition in a woman's life, but there are things to help. I mean, besides just hormones, but the attention is great because it's long overdue.
Right. Oh, I completely agree. I have asked different friends and people that I know that have gone to their providers, and some of them have gotten good, feedback and reception.
Yeah.
Others have been told, oh, you need an antidepressant, or, oh, this is just normal. This is just the season of life that you're in. And I've said, no, yes, it is a natural transition, but the symptoms and the impacts to us are not, and there are things you can do, whatever route you choose to go. And so I have encouraged them, if you go to your provider and they're not interested in going down a path, whether it's hormones or something else, go to another provider, right? Come and see you, just because, and that's what I decided to do. I didn't have that experience. I see an ARNP, and she's great, and that is not my experience. But I have many people that I know that have had that experience where they've gone in and got the kind of the door slammed in their face, so to speak, when it comes to the hormone conversation. And so when you and I met and we decided to do these podcast episodes together, I wanted to go through this process myself so that I could personally speak to what it's like, because I was interested in learning more about hormone replacement therapy, because I was having, and I would say my symptoms aren't horribly severe, but they're definitely impacting me, especially the sleep and a few other ones. And so again, whether you have a Dr. Teggatz in your community or you don't, seek someone out. There's also a lot of online companies now that are getting into this space. And I will link to a few of those that I know to be reputable. I don't personally use those, but I know some that do, that have been recommended to me. But if you're in a community that has a clinic like yours where you can go and sit down with the provider face to face, I think that's always kind of a preferred way to do it. Awesome. But my experience with you, first of all, I was just impressed with the thoroughness of, before I think I even came to see, I came to see you. I think my visit was like an hour and a half, and you were just asking me all of these really great questions. And it wasn't even just about it was all my overall physical health, all the symptoms, kind of going through all the different things, whether it was sleep or libido or, the hot flashes or the night sweats. You really did a very in-depth evaluation of me. And so I knew you were getting kind of the total picture of my health. And then what I also really like is that I have a binder at home on my shelf that I have all of this great information, especially now that I am going to be starting hormone replacement therapy very soon. I know exactly how to do it, dose to give myself, what I might feel if it's too much or too little or whatever. I feel very informed, very educated, and empowered, really. Like I'm taking this, I'm taking control of this. I don't have to, like you kind of said, like and some women have it so bad they're just suffering, know? And so I just am so appreciative of just the thorough nature of everything that you're doing, but also all the great information that I walked out with. It wasn't like you just said, well, here's your hormones, see you later. It's very like, it's lots of follow through and follow up.
Lots of contact because women have questions, as your symptoms improve, or lots of questions. We've got 3 different hormones to manage. So we can definitely, we're here to support you.
Yes. And I very much do feel very informed and educated and supported. And I have lots of great information right at my fingertips. And I know you guys are just a phone call away. I don't have to wonder about something that I'm experiencing. I can just pick up the phone and I know I can get, the information. So I would just encourage anybody listening, after you've heard this conversation, if you're interested at all about ways to address the symptoms you're having, again, whether it's the hormone route or some other type of route, I will put a link in the show notes to Dr. Teggatz's office, obviously. But if you don't live here in Eastern Iowa, I will put more information of how you can connect with a provider to have this conversation, because it's important and you owe it to yourself. And so, like you said, the quality of your life to have this conversation and decide the best treatment plan for yourself. So
absolutely.
I just can't encourage people to do that enough. Well, this conversation has been so great. I'm so looking forward to starting on my own journey of HRT and just continuing to, feel better and
absolutely feel like yourself again.
Exactly.
So you can go out and do the things you want to do. And
have that quality of life that we all deserve. We're all worthy and deserve that. And if there's something out there that can help us, why not check it out? At least educate and inform yourself so you're going in with eyes wide open.
Right.
Exactly. Thank you, doctor.
Well, thank you for having me.
If you're enjoying the podcast, please follow the show to make sure the latest episode is on your podcast feed each week. I would greatly appreciate a rating and a 5-star review on the podcast platform you're listening on. It helps others to find the show. If there are topics you'd like me to discuss on the show, please email me at themarvelousmiddleagepodcast@gmail.com or direct message me on Instagram at Nicole Stute. Thank you for listening.